Hi everybody, my name is Swati Maan. I'm a dentist. My purpose of talk today is what is the right age for our children to have braces? Well, we all know that why do we need braces? The purpose of brace is to align the teeth and to align the bite, what we also call as occlusion, because the bite is extremely important in the long term to prevent any trauma to the teeth and to prevent any trauma to the jaw bones. And also it carries an aesthetic component as well. So generally what we see is the children, they have braces from the age of 11 to 15, because this is the age when the density of the bone is not very hard. So the teeth and the jaw can take the pressure of the orthodontic forces. And by this time, our children have the full set of the permanent teeth, which is important for the teeth alignment. But the right age for your child to meet the orthodontist for the very first time is from the age of 7 to 9. This might sound a little bit too early, or your child may not have braces from the age of 7 to 10. But at this age, orthodontic assessments can be done, because the relationship of the teeth as an outcome of braces is not just about how your top and the lower teeth are related to each other, but this is also associated with how your jaw bones are related to each other. That means what is the relationship of the top jaw with the lower jaw. And by seeing the dentist or orthodontist from the age of 7 to 9, they can do a skeletal assessment, which means to say they can identify the growth pattern of the child and can appropriately do some growth modification with the help of some appliances if needed to. I'm going to explain you what are the three different types of jaw relationship, what we can see in children and in adults, so you know that what to look for when you take your child to the orthodontist for the very first time. So the first type of relationship is called as a class 1 relationship, which is a normal relationship. So if you look at the side profile of your child, you will see an average one straight line, which means the distance between the top and the lower jaw, or the top and the lower teeth, is approximately a couple of millimeter, or let's say 2 to 3 millimeter. This is an absolutely normal growth pattern, and the child will have braces at the right age for the alignment of the teeth if the teeth are crowded, if there are spaces between the teeth, or the teeth are not aligned properly. So the child does not need any kind of growth modification in the class 1. Now comes the class 2. So if you look at your child sideways, you will see the top jaw is much ahead of the lower jaw. So the relationship looks like that. That means the distance between the top and the lower teeth, or the top and the lower jaw, is quite a large distance, which is more than 4 to 5 millimeter. Mostly the children who has a thumb sucking habit for a longer period of time, let's say more than the age of 5 or 6 years old, they try and press their palate quite a lot while they suck their thumb or suck their finger. And they tend to push the top jaw a bit more forward than normal, and they tend to have a more class 2 relationship. So if you see your child having this type of growth pattern, and if your dentist sees your child having this kind of class 2 growth pattern, they might provide your child some appliances, myofunctional appliances, which will modify the jaw growth in terms of a face bow, which will restrict the growth of the top jaw, or helps in the further growth of the lower jaw, so they can form an average relationship. So usually these kind of appliances are called as a myofunctional or functional appliances. They are worn by the child every night, and that really helps in changing the profile of the child and helps in the right growth pattern. Number 3 is a class 3 relationship, which is a reverse of class 2. So here, if you look at the child sideways, the lower jaw or the chin looks much more protruded compared to the top jaw, which means the lower jaw is ahead of the top jaw, what we also call as a reverse bite. So in this case, the dentist might provide your child a chin cup supported by the face bow, which won't let the lower jaw grow any further, or they might provide your child some expander for the top jaw, which will affect or increase the size of the top jaw so they can form an average relationship. So that is why I was saying that 7 to 9 is a great age for taking your child to the orthodontist so that they can have a jaw assessment and the right action can be taken so they don't need braces for a longer duration. Because if the growth keeps on happening in a reverse manner or not in the right manner, the child might need a surgery to correct the jaw or the face profile. So now you know that why early jaw growth assessment is so important, because orthodontics is not just about having braces and it's not just about getting the right position of the teeth, but it's also about getting the right profile of the facial structures and the jaw bones as well. So if you have a child who's 6 or 7 plus, do book an assessment with your orthodontist and take the right action. As I always say in all my videos, in dentistry, sooner is always better than later. And if you've got any questions for me regarding this, feel free to drop me the message in the comment section. And I will say bye-bye for now, and you will see me in my next video. Thanks again for watching.